Hello. Okay, I think we're good here. So good afternoon. All lines have been muted to ensure the quality and audio that we provide a distraction-free learning environment. At the end of each presentation, we will allow for a short Q&A. You can use the comment section to send questions. I'll be able to facilitate your questions with each presenter. At the end of this program, we will send you an evaluation. We ask that you please provide us feedback to best serve you and provide our sponsors with information needed to continue to support our efforts. With the completed evaluation, we will select at random 3 prize winners for a $25 gift card. We will announce those winners Monday. Also, everyone that's registered and attends this summit will receive a gift from the chapter. After you submit your evaluation at the end of the program, we will send you a complimentary personal protection kit. So we will now begin the program. Welcome and thank you for joining us for the 2020 Virtual Lupus Summit Part 2. My name is Leslie Tierney. I'm the Vice President of Operations for the Lupus Foundation of America, Greater Ohio Chapter. I'm a registered nurse and I've been working for the foundation for over 20 years. In my work with the LFA, I've seen firsthand the triumphs and struggles of lupus patients. This is especially true now during the COVID-19 pandemic, where lupus patients are facing new challenges. How do lupus patients adjust to the new normal? The whole world is trying to adapt, but for lupus patients, this is especially challenging. Your health and safety should always be top priority. Although we cannot physically join together, we are still able to provide you with the latest, most accurate information on lupus. From the start of COVID-19, our chapter has ensured that lupus patients across Ohio have the most up-to-date, relevant information on COVID-19. While we still do not have all the answers, our chapter website is designed to provide you with as much information on COVID-19 as possible. You can access the information at lupusgreaterohio.org. There are financial tools, information on hydroxychloroquine, the latest on COVID-19, and information on Benlysta and Medicare. Please take the time to visit these valuable resources. Also, although we are facing the effects of isolation, we do not have to be fearful. We can continue to guard ourselves with an arsenal of information to move forward in our rapidly changing world. If I can stress anything, please remember to follow the CDC guidelines and be sure to protect yourself. Stay home as much as possible, wash your hands, and keep your hands away from your face. This year's Lupus Summit is very different than in years past, but we're grateful to be able to still host and gather with one another. Please know the chapter truly cares about you and your journey with lupus. To all our members that we look forward to seeing and gathering with normally, we miss you and we look forward to seeing you soon. Today, though, we've gathered and learned from our lupus experts here. This is a stepping stone to help the lupus community move past the COVID-19 stay-at-home order. We must focus on staying healthy, and that includes making sure you're taking care of yourself and being a proactive, educated lupus patient. Remember, knowledge is power. Before we start the presentations, we do have a disclaimer. Your physician is the best person to help you in the treatment of lupus. The information you learn here today can be discussed with your doctor, as your physician knows your medical history best. Please do not make any medical changes without consulting your physician first. We have an excellent panel this afternoon. Joining us today here is Dr. Stacy Ardoin, Dr. Beatrice Kenol, and Cindy Fisk, registered nurse in BSN. Our first speaker is Dr. Stacy Ardoin, and I need to, she really, you know what? Let's just see. Oh, ladies, I think I need to start the broadcast here. Let me see here. All right, I'm so sorry about that. Can everyone hear me, my panel?
Yep, we hear you.
Okay, good. Thank you, Cindy.
Yes, yes.
Let's just make sure. Okay, sorry about that. All right, sorry, Dr. Ardoin. I wasn't sure. It looked like the broadcast hadn't started. Can you hear me okay?
Mm-hmm.
Okay, Okay, our first speaker is Dr. Stacy Ardoin. Her topic today will be Let's Talk Lupus. Dr. Ardoin is a board-certified rheumatologist at both Nationwide Children's Hospital and the Ohio State University Wexner Medical Center in Columbus, Ohio. Dr. Ardoin is a strong supporter and advocate for lupus patients, and both at a local and national level. She's also an associate professor in the Division of Rheumatology and Immunology at the Ohio State University College of Medicine. And so we'll let Dr. Ardoin take the virtual floor here, and I'll help navigate. Can you see the presentation okay, Dr. Ardoin?
Yes, I can see just fine. First, I'd just like to thank Leslie, Adrienne, and the Lupus Foundation for the opportunity to be here today. It's a real honor, and happy to participate in this virtual summit. We decided on the talk title of Let's Talk Lupus, really to focus on some of the most common questions that I receive from some of my patients with lupus, and just some fun facts to share as well. Next slide. So these are some of the questions that I frequently discuss with patients I see in clinic, and so I thought it would be good to cover some of these, and certainly I'm happy to try to answer other questions people may have at the end of the session. So we'll be talking about diet and lupus, the medication hydroxychloroquine, what are some ways I can stay healthy that don't involve medicines, talk a little bit about vaccines, and then of course a topic that's on everybody's mind, which is COVID-19 and anything patients with lupus should be doing special in that setting. Next slide. So one of the most common questions I get is there a diet I should follow for lupus? And boy, do I wish I had a better answer to that question than I'm going to share with you, because I think one of the most understudied areas in medicine is how nutrition affects health and illness. There are many, many diets that are advertised on the web or advocated by individuals who have derived benefit personally from certain diets. Some of those include gluten-free or anti-inflammatory diets. And while those stories people share may be very powerful and may work for individual patients, thus far we don't have any evidence that there's one diet that works for all people with lupus. So the one diet that we can recommend for everyone with lupus is really to focus on eating a very heart-healthy diet. As we'll talk about in a little bit more detail later, heart disease is one of the long-term complications of lupus, and diet is one of the best ways to influence risks of heart disease. So heart-healthy diets come in different flavors, literally, but a good resource for looking into these is the American Heart Association, and most of these diets will focus on a lot of fresh vegetables like we see in this picture, as well as fruit, healthy limits to carbohydrates, healthy proteins, particularly lean meats, and just really having a balanced diet focused on meeting your caloric needs with fresh food whenever possible. Okay, next slide. So a lot of people ask about hydroxychloroquine, and I have this picture here because hydroxychloroquine really is our wonder drug for lupus. And while it seems sometimes like a hassle and a pain to have to take this medication all the time, I really do want to explain why your rheumatologist is always talking to you about why it's such a good idea to take this medicine. So hydroxychloroquine is interesting because it's been around for a really long time. It was initially developed as a therapy to treat malaria, of all things, but it was noted that patients who were taking this drug for malaria treatment or prevention who had autoimmune diseases, including lupus, tended to do better. And this led to research to better understand how and why this medication helps people with lupus. So there have been several very important studies that have been done which show us very clearly that taking hydroxychloroquine every day when you have lupus does decrease the number of lupus flares. It may not be a medication that's adequate to control the disease or prevent all flares, but we do know that patients who take this medication either alone or with other medicines will have fewer flares than those who don't. We know it also decreases the risk of having a blood clot, and that's important because patients with lupus are at increased risk for developing blood clots. There are also some large epidemiologic studies that suggest that when you compare patients with lupus who take hydroxychloroquine to those who don't take hydroxychloroquine, the people who do take the medication have a lower risk of developing kidney disease and cancer. And as those are two very important problems that people with lupus sometimes face, we think this is a really wonderful preventative opportunity by taking this medication. In addition, When people with lupus are pregnant, this medication is important to continue and not stop. It is safe for the baby and it's safe during breastfeeding. In addition to that, it reduces the risk of pregnancy problems, including the baby developing neonatal lupus. So hydroxychloroquine is a great medicine for people with lupus. I kind of view it as like a vitamin for lupus. It may not be the only medication you need, but it's something you really want in the background to help to protect you against some of these problems. There will be some patients who achieve a very sustained remission, and in those instances, maybe there will be discussions about whether to continue the medication, but in general, we really do recommend that people continue this medication pretty much indefinitely. Next slide. So how do you stay safe with this medication? In general, hydroxychloroquine is very safe. One of the most important things that we ask patients to monitor for is for eye toxicity. When there is eye toxicity, this medication can affect the back of the eye called the retina and can impair peripheral vision as well as color vision. It's not going to cause symptoms like dry eyes or blurriness or symptoms like that. And usually the symptoms really aren't very noticeable. We always want to find these problems in the back of the eye before they would ever cause you any problems. So this does require you to see your eye doctor regularly and become very good friends with your eye doctor. It needs to be an eye doctor who's comfortable with doing the latest recommendations for hydroxychloroquine safety. All ophthalmologists should be trained in this, and there are many optometrists who are as well, but please check with your eye provider that they know the new test that they should be doing for Plaquenil. So this will involve usually a yearly exam. Some eye providers may prefer to see patients more often if they have any concerns. And there are two major tests that the eye doctor will do. One is called a visual field test, which you see on the right side of the screen. And you guys have probably all experienced this who are taking hydroxychloroquine, where there are little dots and you have to see whether you see them or not. And ultimately, this ends up being a printout of where you can see in the outside parts of your vision or the peripheral vision. The other test is sort of a newer test called the optical coherence tomography, or OCT test. As you can see in the picture, there's a man who's having an OCT test performed. And this actually takes some nice pictures of the back of the retina and measures how thick the retina is. And then this can be compared over time. So sometimes people will complain to me that they have to come in for a separate visit for this OCT test, which certainly can be a hassle sometimes, but it's really important to maintain your eye health. Your rheumatologist will work with you to make sure you're on the right dose of medication. So usually we try to keep the hydroxychloroquine dose for all patients with lupus at a dose that's equal to or lower than a dose based on your weight. And that dosing is 5 milligrams per kilogram per day. So that's very important. With the COVID-19 pandemic, you may have been hearing more about hydroxychloroquine, which was initially thought to be a treatment for COVID-19. It turns out thus far we don't really have any evidence that it really is an effective treatment. There was initially some concern that lupus patients would have trouble getting their medication, and that certainly was the case for some people who lived in areas such as New York, but hopefully that shortage problem has resolved. You also may have heard about concerns about heart problems with hydroxychloroquine. And there is a rare side effect where the hydroxychloroquine can affect the conduction system of the heart, but we don't find that that happens at the doses that we use to treat lupus. And at this time, it's not a recommendation to have any additional heart screening while you're taking this medication. Next slide. So everybody doesn't like to take a lot of medicines. And so what are some of the things that people can do besides medicines to stay healthy? And these things may seem very common sense, but sometimes they're hard to do. And I just want to try to share with you how important these are and how much of a difference that these can make for you. So some of the things I'm going to talk about are sunscreen, exercise, sleep, stress management, and heart health. So next slide. So another thing you may hear from your rheumatologist all the time is, are you using your sunblock, and encouraging to use it every day? And you may ask why. You may even be a person who isn't really susceptible to sunburns. Well, the reason is because using sunblock truly can prevent a lupus flare. And let me talk with you a little bit about why that is so it makes more sense. Whenever the sun hits any of our skin, it can cause some damage even if you don't get a sunburn. And those damaged cells can enter into the bloodstream. When the cells break open, the nuclear contents of those cells can really irritate the immune system. And that's one of the ways that patients can experience a flare. So even if your person doesn't get a sunburn, the skin is still damaging your sun when you're out in it and can induce these kinds of flares. In addition, some people can develop a rash in the sun, a lupus-related rash, and this can prevent those. Certainly using sunscreen will reduce your risk of skin cancer, which is important. And also I like to tell my patients with lupus, but by the time you're 50 or 60, your skin is going to be much more beautiful than all the people who didn't use sunblock. So that's just a little bit of icing on the cake for using sunscreen. Next slide. So what kind of sunscreen? There are about thousands of different types of sunscreen out there, and it can be a little bit overwhelming. Well, in general, at least an SPF of 30 is recommended, and I usually say I recommend 45 or higher. Once you get about over 50 or 60, probably there isn't a lot of added benefit to higher numbers. One thing that's really important is to look at the sunscreen and see whether it blocks both UVA and UVB light. Some sunscreens will only block one type of these lights, and because in the environment you're exposed to both, it's really best to have a sunblock that really protects you against both forms of ultraviolet light, both A and B. In general, lotions and creams are best because you get them on your skin and you know it's there. Sprays sometimes you will think you have it on your skin, but it kind of sprays to the side and doesn't cover you as well. However, I would say it's better to use spray than nothing. So if you really can only tolerate the spray, it's okay to use that, but just keep in mind that a lotion or cream is best. And then beyond that, I just recommend that people experiment. If you don't like the smell or the texture or how it feels, just try another one. There are so many out there to try. Just take the time to figure out which works best for you, because this is so important for managing your lupus. Okay, next one. So the other question is when. So a lot of people say, well, I don't really go outside. I don't really need to use it. And we really do recommend that you use it every day, no matter what the weather is all year. And I'll tell you the reason for that is that UV light does sneak in there and affect your skin, and UV light does sometimes when you don't even think about it. So here's a woman who's driving in her car, and even in the winter, you're getting a lot of sun exposure when you're driving in your car. If you think about it, you're surrounded by windows, and even when it's snowing outside, the sun then will reflect off of the snow. When I say when it's snowing outside, the sun will reflect off the snow and you have even more sun exposure. So even in the winter time, using sunblock is really important. And there is some UV light exposure with overhead lighting, such as the one seen in this grocery store, or that you might see in different office settings. So really, it's best to make this a daily habit, no matter whether you're outside or not. And then the other key is, particularly when you're outside or exercising or going in water, it's important to keep reapplying, because the sunblock will wear off as you perspire or as you're in water, and you need to keep putting it on. Okay, next slide. So the next topic is one that's really important to me, and I focus on this a lot in clinic with the patients that I see, and that's exercise. I think this is one of the most important things that a rheumatologist can prescribe for their patients. Exercise can improve your heart health, your bone strength, help you maintain a healthy weight, which is really important, help you combat fatigue, which is such a common problem for people with lupus, help your mood, and also reduce joint pain. So it can work in many different ways to improve your quality of life when you have lupus. Next slide.
Sorry, Dr. Ardoin, it's
That's okay.
giving me just 1 second. There we go.
No problem.
Okay.
Well,
it did it.
That's good. So I like to give people a little bit of proof that exercise actually works. And this is actually a study that was performed at Ohio State by Dr. Jarjour, whom some of you who go there may have met him in the clinic. And he actually did this study in mice. There are certain mice with the genetics that develop lupus. And these mice were literally given little treadmills in their cages. They didn't look quite as cute as this one, but they did have treadmills in their cages. So half the mice had a treadmill and half the mice didn't. And otherwise, the mice were exactly the same. They had the same food, they had the same genetics, so they were basically clones or twins of each other, and they either had the treadmill or not. And it turns out mice like to run on a treadmill when it's around them. And so the mice who were in the treadmill cage tended to use it, and they were compared to the ones who were not in the treadmill cage. And wouldn't you know, the ones who exercised more did not develop kidney disease like the other ones did. And that was the only thing that was different between the two mice. So showing that really exercise can promote better control of lupus. Next slide. And of course, mice aren't humans, so Dr. Jarjour's group, and I participated in this study as well, also took this to humans, and we looked at how doing Tai Chi affects inflammation in patients with lupus. And what we found was that when patients did Tai Chi in the setting of lupus, they had decreases in markers of inflammation in their blood. So that was suggesting that exercise, as well as the meditative aspects of Tai Chi, could help to improve inflammation in patients with lupus, which is great. Next slide. And there are many other studies. I counted 32 over the past couple of years that show that exercise decreases fatigue in lupus, it helps to decrease weight in lupus, improves quality of life, reduces pain, and also improves blood vessel health. So plenty of evidence to tell us that exercise is good for people with lupus. Next slide. Next one. Okay, so what is the best type of exercise? This may seem a little bit overwhelming to people. And what I say is to my patients is I don't really care what type of exercise you do as long as you're moving. So you look in the mirror and decide what kind of exercise you enjoy and that is feasible for you to do. I do recommend that you have both an inside and an outside form of exercise so that when weather is not good, you have something to fall back on inside. And I often also suggest that you don't rely on having to go to a gym or any other place. Have things that are easy to do in your own home so you don't have any excuses not to do the exercise. I know I have to do that for myself as well. Next slide. So how much exercise? What is recommended for children who are 5 to 12 is to do 60 minutes of vigorous activity every day, and usually they'll accomplish that through play. For people who are age 13 to 17, it's about the same, about 60 minutes of exercise every day. For us adults, we really look at it more on the week. So we try to do 150 to 300 minutes a week of moderate activity or 75 to 150 minutes of vigorous activity. Now that sounds like a lot, but keep in mind you don't have to do it all in one sitting. So if you do 15 minutes 10 times a week, so that's meaning 15 minutes twice a day during the weekdays, you've accomplished your goal and you'll notice some improvement. So if you can set aside that short period of time, you can really help yourself. Next slide. Now, I think we all underestimate the importance of sleep and often overlook that we're not getting enough sleep. And sleep is critically important to maintain your energy, to foster a healthy mood, and also a healthy immune system. I recommend that everybody aim for 8 to 10 hours of sleep per night and really try to avoid things that will decrease your ability to sleep well. And that includes consuming a lot of caffeine, particularly after the lunch hour, using electronics within the 30 to 60 minutes before going to bed, and taking naps during the day. When you take naps during the day, your body gets confused and doesn't realize it needs to sleep at night. I also think it's really important when you're having significant sleep problems to talk about that with your rheumatologist or primary care doctor, because there are many medical conditions that can interfere with sleep. Some things like snoring could suggest a condition called sleep apnea. There can be other mood disorders that can make it hard to fall or stay asleep, and there certainly are interventions that can help you. So don't hesitate to bring this up if you're not sleeping well. Next slide. And stress management. The first thing I would tell you is try to get rid of stress in your life, but I know that that's impossible. So we need to learn how to manage stress in our life. And it really is true that stress can induce a lupus flare. I don't have the proof slide here, but similar to that study with exercise, we've also done a similar study in mice that made mice have a stressful situation by having an aggressive mouse in the cage with the other mice, as opposed to having a peaceful cage. And similar to the exercise study, those who had stress had higher degree of inflammation and were more likely to develop kidney disease. So we all can think of the ways that we know work best for ourselves to manage stress, because it won't be the same for everybody. So really take an inventory and think about the things that you can do that relax you when you're feeling stressed, and make time for them. It's an important investment in yourself. And then be open to ideas. Be open to exercise and good sleep, because these can really promote stress management. Be open to ideas like meditation, which can help with stress management, and also counseling, where you can learn some skills to manage stress. Next slide. Now I want to take a moment and talk about heart health and lupus. And the question I have for you is, do you know your risk for heart disease? So people can have a risk beyond, even without having lupus. They may smoke, they may be overweight, and they may have a family history of having lupus, or they may have a high cholesterol. But even just having lupus itself without any of those other risk factors really does increase your risk of having a heart attack, a stroke, or heart failure. And that risk is at least 8 times higher than someone your same age and sex who does not have lupus. So it is really important that you take this seriously and do the things that you can do to reduce your own personal risk of heart disease. Some of those things can be either through medications or diet changes or weight loss, managing your blood pressure, also keeping your cholesterol under control, again, keeping weight at a healthy level, exercising. Smoking is a big no-no, because that really increases the risk of heart health. It also increases the risk of having rashes with lupus, so another good reason. And then if you have any concerns about your heart health, talk to your doctor about it. It may be appropriate for you to have some testing done. Next slide. Another question I often get is, what vaccine should I take or maybe not take if I have lupus? So we recommend for everybody with lupus to take routine non-live vaccines. There are some vaccines that contain a live virus, and there are some that do not. And if you ever have a question, ask your primary care doctor or rheumatologist about the vaccine and whether it's a live or non-live vaccine. We also recommend an annual influenza vaccine and vaccines against pneumococcus, the pneumococcal vaccines. They prevent a very important type of pneumonia. If you're taking immune suppressive medications, you definitely should not take non-live vaccines like measles, mumps, rubella, varicella, or chickenpox, or a live shingles vaccine. If you're not taking an immune suppressing medication, it may be okay for you to take live virus vaccines, but it's always important to discuss that with your primary care doctor and your rheumatologist. And we don't know about this COVID vaccine yet, but stay tuned. Hopefully we'll have good information about that too when it's available. Next slide. So that brings us to the hot topic. Is there anything that I should be doing differently about COVID-19? And at this time, we don't really have anything different to recommend for people with lupus than we do for the general population. It's important to do the physical distancing and using a mask, as is recommended for everyone. The good news is we have not seen a signal that people who are on the medicines to treat lupus or other autoimmune conditions really have an increased risk of developing the infection or of having more serious infection. And that is really great news, because we were worried that might be a risk. So for the most part, medications can be continued for people who do not have the infection. If you've been exposed to the COVID-19, or you think you have the infection, or you've tested positive, it'll be really important to have a conversation with your rheumatologist about whether to continue or hold your medications. And then I also encourage people to talk with their providers if you think you're in a particularly high-risk work setting, and whether any adaptations would be appropriate. Next slide. So I just want to thank you for the opportunity to be here today, and I'm happy to try to address any questions that you may have.
Thank you, Dr. Ardoin. So we're going to open the lines up here and see if we can, our participants that logged in, there's about 82 participants with us. And if you use your chat box, you should be able to submit some questions. And I will be able to ask Dr. Ardoin those. And many are coming in. So actually, Dr. Ardoin, I have a question here.
Sure.
So this person is asking, what does tomorrow look like for me with lupus? I'm 20 years old, and do you see a cure on the horizon?
Yeah.
Well, that's a big question there. Yeah.
Yeah, so that's a great question. And I hope there is a cure in your lifetime. I don't know for sure. We don't have that yet. We do have a lot better treatments than we used to have 10 and 20 years ago, and there are many on the horizon. So I think it's going to get better and better, and I do hope that at some point we'll have a cure. We had a long period of time when we didn't have any medications approved for lupus, and recently we have, and there are more coming in the pipeline. So I think that's very encouraging.
Oh, yeah. We all look for the horizon there, right? Okay. Where can I get some guidelines on do's and don'ts of living well with lupus?
Well, I think one of the best resources is the LFA Lupus Foundation of America's website. Lots of great information there on many, many different topics. Some of those we talked about today, and some of those we didn't have a chance to cover today. I think that's a really great first step. And also just, conversations with lupus support groups and your peers, as well as with your rheumatology providers.
Okay, another question here is, getting out of bed is the hardest part of my day. Why is that? And I don't feel like I get enough rest at all.
Okay, so for the rest question, that could suggest some sleeping problems, and I would encourage you to have a conversation with your primary care doctor and your rheumatologist about how your sleep is doing and if there's anything that can make it better. In the morning, some patients with lupus who have joint problems will notice that's a particularly hard time. People who have inflammation in their joints will often notice that the morning time is the hardest. They feel very stiff. Some of the best things you can do are to take a hot shower or bath at that time, or just get moving as quickly as you can, because generally speaking, that joint discomfort will get better with some activity.
All right, this person's saying, hello, Dr. Ardoin. Is it okay to start drinking fresh juice and vegetable smoothies since I'm doing great with my lupus at this time?
I think those sound like really healthy things to take. I encourage you to do that. Sounds great.
So great. And forgive me as I'm funneling through, there are a lot of questions coming through as I weed through them. Is there a particular brand of sunscreen that you recommend?
Yeah, I think you just have to figure out what works for you. I've had a lot of people say that they like the Neutrogena products, but I've had a lot of people say they like others as well. There are just so many different ones. I think the key is just making sure it has the UVA and B protection, and that you like it. You like the smell and the texture.
Yeah. Some of them can kind of be greasy at times, so really trialing it for your skin is really good. So yeah. Okay, what is the best alternate to prednisone that could be used to address a flare but have fewer side
Oh
effects?
gosh. Great question. Hard to answer. So prednisone is your best friend and your worst enemy when you have lupus, because when you're having a flare, I don't think anything works as quickly or as fast, but as you mentioned, it does have a lot of side effects. So I think for a bad flare, prednisone is usually part of the equation, but what we try to do is minimize the steroid exposure. And if people are having a lot of flares, that's where we start to use other medications, other immunosuppressive medications that we hope can do the work of prednisone, so people don't need quite so much.
Okay. I think I understand what this person's saying. Is Sjogren's dry eyes related to lupus?
Good question. So Sjogren's is an autoimmune disease just like lupus is, and it causes inflammation of a lot of parts of the body, including the glands. Some of those glands are in the mouth that make saliva and in the eyes that make tears. So people with Sjogren's will often have dry eyes and dry mouth. People with lupus can also develop Sjogren's, or people can have Sjogren's without having lupus. So they are sort of like cousins of each other, and they can also both occur in the same person.
Okay, let me see here. This person's asking about red meat and green teas. Are these okay to eat and drink?
I think everything in moderation is okay. I don't see a reason to tell anybody to avoid those. Just, nothing excessive in any category.
This is a new patient. I'm new to this whole world, and I'm in the process of being diagnosed. Signs and point to autoimmune. What do you think I should do, and what doctor should I talk to?
So when you're going through the process, as many people who are on this call, I think, can probably relate, the process of getting diagnosed when you have lupus can sometimes be frustrating and take a long time. I suggest that people really write down all their symptoms. So sometimes when you go to the doctor's visit, you kind of forget all the details, and that way you have it all written down. I do think if there is concern about lupus in particular, I would talk to a rheumatologist. They're going to be the people who are the best equipped to help you decide if you have that or not, or if there's something else causing the symptoms. But lupus is tricky because a lot of the symptoms that people have with lupus can also be seen in other conditions. So it does require some detective work between you and your rheumatologist.
Just for sake of time, Dr. Ardoin, I'm going to ask one more question here.
Sure.
And I think it's a great question, so thank you who submitted this. Can you discuss the heart side effects that have occurred with the long-term use of Plaquenil? I've had some heart issues and my cardiologist has been unable to find anything wrong with my heart, actually.
Yeah, that's a really great question. So first, I just want to say that cardiac side effects with these medicines in the setting of lupus are uncommon, and that you can get cardiac or heart problems just from having lupus. So it can kind of be hard to tease apart. The problems that can be seen with Plaquenil are usually when a dose higher than what is recommended for lupus is given. Some of them can be conduction problems in the heart, so that means putting you at risk for abnormal heart rhythms. Although I will say people with lupus are at risk for that even if they don't take Plaquenil, so it can be hard to tell whether the medicine is to blame, but a cardiologist can usually help. And then very rarely, if people have been taking a high dose of Plaquenil for a long period of time, again, higher than the doses that we recommend to treat lupus, there can be some injury to the heart muscle. And so that does require a heart doctor to help figure that out. But again, I want to emphasize that those side effects are extremely, extremely rare, and the benefits of this medicine generally outweigh, unless you're a person who's unfortunately affected.
Thank you, Dr. Ardoin.
Thank you.
And if I apologize if we didn't get to all of the questions, but perhaps at the end we'll have more time to address more questions, okay? So that leads us to our next presenter. Our next presenter is Dr. Beatrice Kenol. Her topic today will be lupus and disparities. Dr. Kenol is a board-certified staff rheumatologist at the Ohio State University Wexner Medical Center in Columbus, Ohio. Dr. Kenol is multilingual in French and Spanish, and she has a special interest in treating lupus and other associated autoimmune diseases. So thank you, Dr. Kenol, for joining us, and I will again be helping. Please just bear with me as I move through your presentation, but thank you for joining us. Oh, Dr. Kenol, and I think your microphone, there we go, very good.
Okay, good. So again, I want to thank everyone, Leslie and Adrienne and the Lupus Foundation, and especially the Untitled Chapter. So I'm very honored to be here, and also with Dr. Ardoin, which I work with, and then with Cindy too. Just moving forward from what Dr. Ardoin mentioned about the lupus information, but now we're going to focus on more disparities that can happen, and especially specifically discussing how lupus affects different people, and how does that happen, and a little bit more details about that, and hopefully what can we do to improve upon those problems. So yes, you can. I'll go through the slides a little bit more faster, but I just wanted to first have some definitions and explain how this topic is very complicated, because there are different definitions for disparities, and also it's a very hard topic to study, but I wanted to just give a little background on lupus in addition to also how disparities are defined, and see a little bit overview of the studies and the proofs that have been out there. So I try to put some summaries of the data that that there is available now, but I just want to start by saying that as lupus doctors, and I'm sure all of us will agree here on the panel that we can see that there are differences in how lupus affects different people, and we'll go through that together. But it's very hard to study because the definitions are either imprecise or are varied from location to location or from studying entities. So we can go to the next slides, and I'll just explain more of that in more details. For example, next slide, please. So just the differences in disparities. So it's important from a government standpoint too, and for us to differentiate between health disparities. So it's how the disease affects different people, and also their healthcare disparities, so difference in access to the doctors and the hospitals, and where to get treatment. So there's different levels that disparities can occur. So basically, lupus patients can have different experiences based on how lupus affects them specifically, or also there's another level that can complicate things more, is how easy it is for them to get access to going to the doctor and getting diagnosed properly, and also continuing to maintain treatment. So we'll just go based on the definitions by the government for the purposes of these studies, because that's what the studies do when they do research. Okay, so next slide, please. And so another thing, so that please don't feel like you have to read all these words. I just put it there just because it's so long and complicated, just so the definition from the government from racial and ethnic categories, it's very complex. And I know, and you know, being a person of color myself, and I'm an immigrant too, and I'm from Haiti, so there's a lot of different categories that we could define each patient and each person in America, in the world, but based on the definitions from the government, it's the categories usually don't really fit exactly. So I know all of us have to fill out forms usually, and usually it's all white, black, or Hispanic or other, and sometimes there's not even boxes for Asian sometimes, or there's not even different boxes for whatever you identify with. So I know there's limitations in that, and I just want to clarify that for the purposes of this presentation, that we are aware that these definitions are not the best, but with this, they are what we work with for the research, but we're trying to do a better job at that. But also defining things by race, it's a construct, and we haven't never proven that the race definitions have genetic changes. And actually, most people's DNA are very, very similar, regardless of the race. But we do know that there are some ethnic differences as to how lupus affects some patients. So that's what we'll go through today and try to tease out all these complicated information. But we'll see if you have more questions later, but just to clarify these little topics before we get into the differences themselves. Okay, next slide, please. And another thing too that's very important is that the definitions right now from most studies are just male versus female, and we know that there's cisgender and transgender differences, and that those terms male and female don't really reflect how a lot of people identify themselves. So that's why we understand this, but also a lot of research documents are not really up to date with those definitions that are best. So just for the purpose of this presentation, we'll use male and female based on what sex was assigned at birth, and that's what most studies have looked in the past. But we know that we have different patients that have different situations, and there are different hormones, so we can talk about that too, because that can sometimes affect differences as well. So next slide, please. So I know Dr. Ardoin touched to a lot of things that we can do about lupus, but just a quick review. We know that lupus is a disease of the inflammation of the immune system that can affect the organs differently. Some people have just lupus in the skin. Some people just have lupus in the kidneys, and they didn't even know that they had it until they had really bad kidney failure, and they can be diagnosed at the hospital like that. But some people know that it runs in their family, and some people have the face rash. So there's different kinds of lupus symptoms, and some people with lupus can relatively be have just mild flare-ups, but a lot of people, as we know, have very severe disease and require hospital stays a lot of the time, that or be on a lot of medications. Just the differences in the lupus manifestations themselves there is a difference between, not everybody with lupus has the same symptoms. So I know a lot of us on the panels and also all the attendees today, we might all have the diagnosis of lupus, but everybody's a little bit different. So that's why it's very important to talk to your rheumatologist and also tell us all your symptoms. And that's why we ask you all these annoying little questions all the time, is because a lot of people have different symptoms too. So it's important to know that to treat you better. But just overall, the fact that different patients, if you know somebody that has the worse or better outcomes than other people, it doesn't necessarily mean that they have the same kind of lupus. So there can be differences in just the lupus itself. Okay. So next slide, please. Now, we'll focus more on just does lupus affect people equally, and what we have been able to see when we look at a general the population to see if there are big differences that we can comment on, and to see if there are big things that we can conclude on how lupus affects people. So question, does lupus affect people equally? We could guess by now that it's not the case, and we can go through the next slide. Will show some ways that we can try to break it down and try to see where those differences can come from. So there are different levels. So you can have, like we said, problems, differences in healthcare systems, and then differences in the individual or the community as well, and also where those meet in the interface. You can see how all these things are variables that can have a different outcome on a lupus patient. So we'll try on this presentation to just briefly go through different examples of how there are disparities in the healthcare system or the access to care, or also different individuals, and how that happens. So first, looking at the different outcomes of just how the lupus disease is different in different people. So next slide, please. So for example, just comparing to males and female, it's different here. So we know that lupus affects more females than men. So there's those studies are up to 9 times more likely to have lupus in women than men. So we don't know exactly what's the reason for that, but there are clues that there are some gene changes that can be correlated with this, but we haven't really proven that there's one genetic problem that can happen in women more than men. But we know that the women that develop lupus usually are diagnosed during their childbearing years, and there are research of studies that are being done to see what the roles of hormones could be in women, and maybe because they have those specific hormones that or anything going on with their chromosomes that can make them more likely to have lupus. But there's still studies going on with that, but what we know for sure is that there's more lupus in women than men. Next slide, please. However, although lupus is not as common in men, when we have male patients, sometimes they can have more severe disease, and they can have more severe disease in the kidneys specifically than men. So there's some small studies that have shown this, and but the studies are really small, and we can't really make big conclusions from them. But that is I think that we should note. We know lupus is more men and women in general, but when men do have lupus, sometimes they can get really sick as well. So that's something to keep in mind. Next slide, please. And then we know that, as Dr. Ardoin mentioned, that's why it's very important to stay healthy otherwise and have a good exercise regimen and sleep. And because all those problems like not exercising enough or having an unhealthy diet or even sleep issues can cause more risk of heart disease. And men have more heart disease than women usually. And also in lupus, there are some studies that have been shown that that men are more likely to have complications from the heart disease from lupus than women. But again, those studies are small, and we need to do more studies about that. But those are some clues that we have so far. Next slide, please. And also, when we compare different ethnic minorities, and there is a cohort called Lumina study that looked at that and different ethnicities, and we could see that there are marked differences between white women, Black women, and Hispanic and Asian women. And so the data of that study showed that the lupus incidence rates, which means how much lupus there is the highest in Black women. And specifically, it can be up to 4 times as much lupus in Black women than in white women. And so another study that showed that it can amount to 1 out of every 250 Black women in the United States can be affected by lupus. And studies too, Hispanics and Asians and Native American population are also more likely to develop lupus than their white counterparts in America. Next slide, please. So that's another study as well that looked at how early does the lupus happen. So the lupus happens earlier in Black women. So if you look at that graph, the pink area here is the Black women, and then the Black men were in the green. So even in the Black population, you can see that women are much more affected than men. But then when you compare women versus women, they look at Black females and white females. So the top pink graph here compared to the light purple one, the light purple one represents the white women. So you can see the amount of lupus is higher in Black women, and also the peak starts earlier. So their age is younger age has more lupus in Black women compared to in white women. The lupus happens a little later, but it's also less likely to happen as well. Okay, and towards the older age, most all the populations meet there, and a lot of the risk is lower with age. Next slide, please. So that is another kind of way to look at it too. They looked at how early does the damage can be found compared to different populations. So that study looked at Caucasians, African American, Hispanics, and they broke down Hispanics into American Hispanics in Texas, and then Hispanic people from Puerto Rico for some reason. So they see so each study is a little bit different on how they choose to break down these categories. So we can see for those studies that the damages in lupus occurs earlier in Black and Latino folks. So that's another kind of difference that we see. Next slide, please. And so also we'll look at how, so we know that lupus happens earlier, and also the damage happens earlier on the organs. And so now we're looking at the death rate specifically. Again, the same thing, the Black women are more affected compared to the white women. So that study specifically looked at how much more likely does a Black woman with lupus die compared to a Black woman who doesn't have lupus. And then they looked at the same thing for white women with lupus versus white women who don't have lupus. And the rate of increased death rate from lupus can happen more in the Black population compared to the white population. Although all the lupus, having lupus just increases your disease and death rate anyway, but the Black women are affected more. Next slide, please. So again, that study shows the same thing, and it showed that the mortality rate is higher and happens earlier compared to white women, and that study is from the 2002 to 2004. So a lot of this data is a little bit older, and they're still doing more studies, but this is the kind of data that were available for us to discuss today. Okay, and so next slide, please. So again, it's another study that showed that as well. So this one is a little bit different. It broke it down by age groups, and there's a tiny difference. Is that we see that the highest group of death rate is in the middle age of the breakdown for them is like a 45 to 64 age range, and lupus patients that are Black that have the highest mortality rate compared to the white women over there. So all the blue dots and lines are representing white women. So the top part of the white women as group is the oldest white women. So what we can say about this is that lupus is definitely deadlier in Black women, but also with age, the deadliest rate is for women that are the white women. The older they get, the more likelihood of the death. But in Black women, the middle age group is the most affected, but the death rate is lower after that. So when you see that the solid line here is a little bit lower. So mostly lupus affects the Black women in their earlier age range compared to white women. That's another way of looking at it. Next slide, please. And also the study looked at the age as which Black women die is 13 years earlier than white women. So it's another way to look at it as well. So next slide, please. So we can say, what are those? So all these data that I showed you, and it's already redundant. So there are really differences in men versus women, and also versus different ethnic minorities. So why would that be? So next topic. So you can skip to the next two slides again. So these slides I just included there, and you can look at them later if you have access to the slides. But it's just to break down on how disparities happen in general for all kinds of healthcare problems. So there's been studied for other diseases as well, and they always see that there's differences in the healthcare systems and how each person has access to the system as well, and what happens when they do meet at the healthcare location, and what's the interface between the doctors and the patients, and then also that's in addition to all the individual and community factors that we all know are going on for other things, and especially in this time, and there's a lot of socioeconomic changes too, and also all the inequities in society. So all those things have a role into this, but we'll look at all those things separately as well and see where we can act. So next slide, please. So we'll look at, for example, insurance changes and insurance variability, and see how does that affect lupus. So all these, we'll go through all these boxes and see if we were able to find any clues as to what is a possible cause of these changes. So next slide, please. There's a study that looked at the different kinds of insurance and what happened in people that had lupus. So basically looked at the HMOs versus the fee-for-service plans, and the way that they looked at it is seeing how many appointments that those patients needed and with their lupus doctors. And so they saw that HMO patients needed less appointments than people with fee-for-service, and also that HMO patients needed to have less outpatient surgeries and go to the hospital less than the fee-for-service insurances. So there are differences between the insurance types, and the study can mean that maybe patients that have a HMO pain either are feeling better and they don't need to go into the clinic and they don't need to go into the hospital as much as people that pay out of pocket or have fee-for-service health plans. So that is a clue. And that was when that was done when they surveyed over 900 lupus patients. So next topic, please. And then also looking at other differences and the clinician and patient interactions. You can see the next slide, please. Also looking at access. So those things are kind of related as well. So we can look at them together. Next slide. So there was one study that looked at based on different insurances, how far the patient needs to go to get to see us or see any physician for them. So it looked at a lot of different kinds of insurances, and they saw that Medicaid patients with lupus had to travel longer to see a lupus physician. So maybe different kinds of insurances. We know that you need your insurance to be checked to see if it covers certain physicians and things like that. So that was a clue from that study, that looking at how far people can travel. So you need a ride, and then also gas money and time and all these things can be factors into why some people don't have as great of an access as if you had a great doctor in your neighborhood, for example. So maybe that's a clue of what's happening in lupus. So there's a study that showed that as well. Next topic, please. So we'll look at those few slides because they all kind of say the same thing, and also the socioeconomics. So it looked at rate of hospital among people that are living in different zip codes, and also they can also look at how much money they were making, and also if that had anything to do with how much they would go to the hospital. And so that study showed that people that were from poorer areas or made less money than other patients, they had more hospital stays that could have been avoided. So what that means is maybe that there's some patients that are in poor areas or have just not great access to their doctors, mean that they just end up having to go to the emergency room more often, which is very unfortunate, but that's what this study kind of shows as well. And also that study also mentioned that the age had something to do with it. So the younger patient did better than the older patients, as far as the older patient needed to go to the hospital more often. But we could say that that's pretty kind of standard, in all patients that are older usually go to the hospital more, and that was there in that study too. But overall, the conclusion was that maybe the socioeconomic factors definitely have something to do with how many times they have to go to the hospital and times that could have been avoided. Next slide, please. Also, there are some studies that said that showed that for African-American patients compared to white patients, they have fewer primary care providers. And also sometimes they looked at primary care providers of everyone, and they showed that there are primary care providers have a tougher time getting referrals for their patients sometimes, and their patients can only, their insurance only covers the primary care, for example, and not really specialty care sometimes. That's what that study showed as well. So and looking at the primary care physicians, and they felt like they were unable to provide high quality care for their patients sometimes based on different ethnicities. Next topic, please. And other studies look at the same thing. So that's another similar study that looked at other rates of hospitalizations as well. So that's just another study like that. So you can go to the next slide, please. And then that's another slide that shows some differences between how the access to the rheumatologist does vary. So there's some different states that have less lupus doctors than other states, and they looked at how many what the access was compared to if they had a lot of lupus in their kidneys, and they could see some differences between the amount of doctors around. So the less doctors that there were, the patients had a lot of lupus as well. So we can, next slide, please. Next slide again. So this other slide from that same study looked at the socioeconomic status that I was mentioning before. So and they looked at the fact that with the different socioeconomic status, there is different rates in lupus. So the more poverty situations had more mortality, and so people would die for lupus more if they had more poverty. But when it's adjusted, those rates were decreased. So there's some studies that think that when we adjust the amount of lupus patients, and if they look at if they had the similar status, there's less differences between them. Next slide, please. And so another point to the reason why we need to exercise and manage stress, like Dr. Ardoin was saying, there's a study that showed that increased risk of stress was causing maybe or associated with increased risk of autoimmune disease. That's a study from 2018 JAMA. But so we know that from the mice from Dr. George's lab, and we know that you know, in general, that was a study in patients that we, like any psychiatric problems or any stress in life. And we know one could argue with lower socioeconomic status, there's way more things that they have to think about for stress related. If you're living in a neighborhood that has more stress and around you, that could make you maybe more likely to have immune system problems such as lupus. So this one wasn't specifically on lupus per se, but it was on autoimmune disease in general. So that's the one study I could find that showed in humans that there is more likelihood. But that study wasn't in America, just FYI, there was a Sweden, and Sweden is what they looked at that. And they could see that in Sweden that the stress, people who had more stress and more psychiatric disorders had a more autoimmune disease. Next topic, please. And so we need more studies about that too. So the same way that we don't have a lot of good studies about the diet, but we know that there are things like smoking tobacco that have a lot of relationship with how people get a lot of different diseases, like not just lung cancer, but also heart disease. But we know also with lupus and all autoimmune diseases that the smoking just increases inflammation and also worsens how the patients do. So if you have lupus or any other autoimmune diseases, we definitely would recommend stopping smoking as soon as possible. And that can make the best chance, that could give you the best chance of doing well. And out of all the things that we can do, even better than taking the right medications and seeing your doctor when you're supposed to, stopping smoking has been shown to be the most important modifiable risk factor, is what we say. So the one most important thing that we can change in your life is to get a better outcome is the stopping the smoking. But I listed the other ones out there too, like the pollution and for diet and obesity, hypertension, heart disease, all those things we know that can affect lupus, and we know all these things can affect different people differently, especially different socioeconomic status and different ethnicities as well are hit differently by this. And we'll also have a slide about COVID too later on. So we don't know the differences of exposure of all the things that are bad for you basically can be a reason too why you there are differences in who lupus affects. Next slide, please. We can do a little bit faster too, I know. Yeah, so I just put that in there just for future reference if we can read later on. But basically, there's not really good studies, but there are some studies that mention that solvents, pesticides, or so you know that there's different kinds of population that can be affected by different jobs. For example, like in on farming or in construction, or there's some different things that you can be exposed to that can worsen things that we need to do more studies on. There's also more studies needed on heavy metals, but we know, for example, like the water crises with the lead in the water, sometimes we don't have any, somebody asked me that question if that makes a difference, but we know that there are some other heavy metals like mercury has been shown to increase autoimmune disease or markers in the blood that ANA test. People that have mercury exposure have more ANA test positive, but we don't know for sure about lead. And I know with the water crises in Michigan and you know, that we don't know that if that happens, but there are more sickness reported when you have exposure to heavy metal usually. So we'll need to pay attention to that, and hopefully we have some data soon on that as well. Next slide, please. Oh yeah, so just a reiteration that we need more data for diet and lupus, but there are some disparities and differences between people and what diets they use, so that's another possible reason as well. There are differences too, and you know, and it's very important how people are educated about this topic or even know about lupus. And I know there's some data on the Lupus Foundation website about how most people in America, and like I think it said like 63% of people don't even know about that lupus is a thing. And so educating and raising awareness is very important. So that's a very important job that we're doing for that. But also that can affect how patients respond. If you didn't even know that lupus or how bad that could be or what it is, you might not have a good incentive to follow up to your doctor or you know, understand all the different reasons why it's important to do all these things. So health literacy is how we describe this. So being educated on how and understanding about how your healthcare can be affected by things you do, but also what your risks are specifically. So next slide, please. So a barrier to that is, you know, the research studies, we all know that the minorities are underrepresented and can be ethnic minorities or different gender minorities too. And we don't know exactly, we don't have a good number about that, but we know that the ethnic minorities and clinical research are usually a lesser amount than a white population. And usually sometimes there's some studies that if you're too sick to participate in the study, that you can't even participate in that study. So there are a lot of different reasons why there are research data lacking on specific cases. So we try to base it on the research that we have, but there are a lot of barriers for people to even want to participate in studies, and we have to acknowledge that as well. So like I said, limited awareness, if they don't even know that it's a problem, they might not think it's important to participate in the research to have more data, or they might not believe that it's gonna be worth it, or there are histories of studies that were not really done properly before, or that were not really ethical in the past. So a lot of people especially in ethnic minorities or in Black Americans, they would say that they prefer to have Black doctor, or they don't trust other doctors as much because of these kinds of issues that happened in the past. So there are studies about that too, showing those mistrust between patients and doctors, and we can go through them a little bit in the next slides, please. And then this one, the same study that showed the different disparities between the Black women and the white women death rates. It looked also as how likely the patients were gonna keep coming to the doctor or stay on their medication, and there are differences with that as well. And next topic. Also, you know, this there are some differences. So this is one study from Bina and looked at how effective like prayer frequency or how likely somebody wanted to pray, or different religions too, and also how likely they felt like they were in control of what they could do for their own health, and different ethnicities had different attitudes and different beliefs regarding that, and they showed that a lot of African American had mistrust in their doctors, and they also showed that there were higher rates of perceived discrimination. But these studies are not very statistically significant, but those are the things that we have so far. But it's a possible clue that there might be some changes in cultural differences that can be a problem for that. Next slides, please. And then specifically for lupus, there was a study that showed that some African American patients didn't want to start a medication that was necessary for them because they didn't trust their physician as much as other ethnicities, and they didn't understand that the medication was going to be effective necessarily. So there were some differences between that as well. Next slide. And there's another study too that showed that there are some patients who perceive that there is a discrimination in healthcare, and that can affect that how they follow the instructions or how likely they are to return to the doctor. That study was done specifically in lupus as well, and it's the first study that demonstrated changes in that perception in African Americans versus white people in America. And they said that that had a correlation with low trust in physicians. So if we can make sure that that perception is decreased, or if we can make sure that we're overtly doing anti-racism work, and maybe that will improve the amount of trust people would have and all amount of follow-up they will have with the doctors. Next topic, please. So I just added this slide too as another example of healthcare disparities. So this slide actually was made by a doctor. There's just a slide from a Boston hospital, and they don't have all the data, and it's from in April, and they didn't have all the New York City data but basically this shows the difference between the blue lines are the percent of Black people in the state or in that area. So those are all states except New York City will be there. So the blue side is how many Black people there are in percentage, and then the gray slide is the percentage of Black people in COVID deaths. So you've seen that in the news that the COVID-19 is affecting Black people disproportionately in America compared to the rest of the population. So even like, let's say the first one, for example, is Mississippi. You see that there's about like a little less than 40% of Black people, but their death rate is almost 70%. And we look at the COVID death rates. So that is something that we can see in other diseases as well. There are clues in lupus that like we've gone over, but there are a lot of complex reasons and a lot of complicated things that come into play to explain these differences. But so far, that's what the data shows. Next slide, please. And there are some also that article in the New England Journal of Medicine is a big journal, and that is a recent article from last week. I just put it there so that if you guys can read it as well. But that article, those doctors were just mentioning that we have to acknowledge that those things from the past do affect how things are represented now. For example, even with the slides I showed you that the COVID-19 affects Black people more, those doctors said that in their education conferences that they would have to learn about COVID-19, there is something called COVID toes that is like a skin rash that can affect people with COVID-19 in their toes, and all their a lot of their photos to learn from the people that have COVID-19 education panels. A lot of those photos were just basically of white patients. So that article just mentions that even in our medical training, we need to be extra proactive to make sure that we learn about the diseases from the people that it affects the most, as well as the general population. So next topic. So that's just the summary. So that there's different health and healthcare disparities, meaning the difference as how lupus affects one person, but also the differences in all our systems do affect how each patient receives care, and also how well they do with staying on their medication, and also affects how much they would be willing to participate in research so that we could hopefully find a cure in our lifetime. Hopefully, I'm not sure, but those kinds of things we should definitely work on if we would need to give us the best chance to find something that works. Next things. So I just try to come up with possible ways that those are my personal recommendations, but you can let us know what you think too. And I know that just staying in touch with the Lupus Foundation, just you can give us recommendations of what you think we should be doing better. But just spreading awareness is one of the jobs that the Lupus Foundation does really well. So I think it's very important to keep doing this and tell your family members or other people about how lupus affects you. And we know that we have to acknowledge that there are differences on what happens and how lupus affects people, and also how the system differences affect how the people are going to be receiving the care. And we need to find more data and do better research to analyze this data and move forward, and also act on those things that we find, because we can do panels all day, but until we do something on the systematic level, it won't be as effective than to actually reduce those changes between people. And you know, we're here also, and a lot of us doctors want to advocate for all these things, and also the Lupus Foundation helps us with that as well, to improve the access to care, and explain to us all the changes with why we need to do change our lifestyles and all those kinds of things, and to improve trust and do more research. So I think the next slide is a question. Oh, you can next. That's it. So I put some references too if you want to see more of the studies, but any questions or?
So thank you, Dr. Kenol. You know, lupus and disparities is definitely a tough topic to talk about, and I think as a community, we just need to come together and continue to talk about it. So it is panels like this that will help our communities just build the trust, build the knowledge, you know, get to the doctors that we can early, and you know, so I thank you for this. For the sake of time here, I'm going to go through and open up the panel again for questions. But if we could just spend a short time and follow back up to it so we can have Cindy present as well. And let me just see if there's any questions coming through. And again, you could submit questions to the question bar here. But okay. So someone is asking, what can I do to help others in the community with lupus that may not have access to proper health care? Any suggestions?
Yeah, so that's a big question, but you know, listening and talking to them. So if and you know, reaching out to the patient groups and the Lupus Foundation, like that, there's a lot of information on the websites, but you know, having access to care, there's a lot of times that there are some foundations that can help you connect you with some doctors that could get your insurance. So there's some other clinics that you can have access to. But as a person, if you want to help your fellow community members, just you know, listening to them and try to find the information as well, and you know, try to connect with whatever resources that they need. So and also understand that that is important to follow up on them. And you know, the lupus is a chronic condition, so there's ups and downs, so being there for them. So the fact that you just even want to help them is very commendable. So thank you, and we should help each other, especially when they don't have access to care. So, but foundations like the Lupus Foundations can help us connect and raise those problems. That way, I'm sure they're not the only one in that situation. So if we can get strength in numbers to act on it, that is probably possible. But that's what I would say start with, maybe.
Thank you. Yeah. Are you aware of any key initiatives to help close the gap in health disparities? Is a follow-up question to that. I'll let you answer, Dr. Kenol.
Well, I should have started with a caveat, disclaimer that I'm actually from Haiti in Canada, and I'm not from America. I've been living here for a few years, but I know that there's a lot of advocacy going on as well for other conditions, but foundations like this can connect us to do better work like that and take things forward.
So I was just going to say,
learn more. So, you know, sharing, I'm willing to, yeah, learn about other ones, but I just go through those foundations first.
Well, definitely because of COVID, things are a little bit different, but annually the Lupus Foundation advocates for patients' rights. We go to Washington, D.C. to help advocate. And then on a local level, we also gather up groups of population to hit our state capital to advocate for patients' rights. So this could be a new coalition we could all be working on to bring to the forefront. So definitely, and we'd love to have you be a part of that as well.
Yes.
And I do apologize, just for the sake of time, I'd like to jump over to Cindy here, and if we have some time, we can perhaps answer questions by email. But thank you, Dr. Kenol, so much for your presentation. We really appreciate it.